So there might be a subset of the population of people that, just like a lot of things in each of our respective clinics, where you people aren't in a severe acutely diseased state, but they desire improved wellness or optimized health or improved relationships, improved psychological health. Although it's not, again, like you said, not so severe that they need to be. Well, the hard and fast indications maybe aren't there per se, but there are is perhaps there's this other indication or use case scenario for people that
Yes.
want to access and improve their expand their conscious. I mean, I don't almost sound silly saying this, but expand their
Yeah, I think that's a
consciousness
great way to say it. Also,
and gain insight into their world they wouldn't otherwise be able
we,
to
we
get.
also talk a lot about prevention.
Yeah,
Yeah, and we talk about that prevention. So maybe treating someone like I don't know about my future and what would hold, and maybe I would have a major depressive episode, and maybe I'm actively working on preventing that episode. And so maybe if we took people with job anxiety and we decided to work on that before it became something bad. I was struck with that when in my nursing undergrad is like when I did my psych rotation, it was like, God, these people, like looking at their stories and reading charts, it was so emotionally tough for me to see like a teenager in front of me because we worked at a pediatric place, and then you read their history, and since they were 5 they had all these incidents, and then now they're suicidal. It's like I just remember being struck with like, God, well, you have all this stuff now to untangle. But maybe if we worked on prevention from psychological health, and maybe this is a potential tool for that allows you to upregulate, that allows you to gain some insights, that allows you to work on prevention potentially. And I think also, just because you're not suicidal doesn't mean that maybe you can't improve your psychological health. I think a lot of people at similar ages to us, you reach this crux, and maybe you're not an alcoholic, but you're using alcohol as a means to lean on, or maybe you don't have a terrible divorce destined relationship with your spouse, but maybe it's not ideal, and maybe you're not clinically severely depressed and suicidal, but maybe you have a less you maybe have more depression type experiences than you would like to, and maybe they're not getting better, and maybe that's okay to treat that person, not to just wait until they're significantly meet this criteria. And maybe the current methods we have to treat those are not well established and are not ideal.
you know, it's interesting too because it seems like it's a more powerful agent. Well, clearly you can make some massive progress with talk therapy, but you know, sometimes, and we've talked about this with other medical therapy, like let's think about medical weight loss. You kind of have to meet people where they are. And part of where people are is the society we live in and we talk about like epigenetics and the influence of the different surrounding microenvironments that we're in. It makes it hard. you know, there's a temperament basis on what you're willing to endure and go through, but there's also a social conditioning. I mean, everything's instant, fast, fast, fast. And maybe ketamine is a way to adapt to the microenvironment or the different social aspects and causalities that impact us from external sources that cause us to be the way we are, and so on and so forth. And whereas I was thinking about the example you gave about these young teenagers or young adults who had a long history of things, and they clearly, well, I'm assuming a lot of these cases, sometimes people have been through all these talk therapy, so either they're not willing to endure it, they can't get to it. There's mom and dad have multiple kids. There's the financial constraints, whatever reason, or it's not working, or maybe there's severe resistant cases. And then I started thinking about teen suicide or young person suicide, which is on the rise, especially after COVID and everything. And then it made me think about this case, Jeff, that I had it was awful. It was this kid that was a trauma patient, and I think it was a failed suicide attempt, if I can remember correctly. All I know is that the person was bleeding to death from a splenic laceration and maybe some other internal organ injuries. that I could easily fix as a surgeon. I had the capability, had the wherewithal, had the infrastructure. I was in a level 1 trauma center. This is in Ocala, Florida. It was for a trauma surgeon, and nothing's a chip shot, but I mean, it was very straightforward, right? I knew we had all the imaging. The kid was an excellent surgical candidate. It was an operative case. There was non-operative therapy wasn't indicated. Going to do that, and the parents were like, "No, don't do it." And the kid, because the kid was kind of like awake on the ventilator, came to, was conscious, and was asking to be allowed to die. It was the most heartbreaking mind. I don't want to drop an F-bomb, but it effed with your mind. I mean, I was, and here because my whole persona was saving life. And they said, this kid's had, you don't understand our child. They've been suicidal since they were 10 years old. And it was, maybe they were 15 or 16 or something. And we had to get the ethics board involved, legal entities within the state, legal entities within the city, upper echelon management. And basically they wanted me to sign off and allow this kid to die. And I'm like, wait a second, I have a right as a physician too. To, hey, maybe you want to be part of this, but I don't want to personally be part of killing somebody or allowing someone to die. I mean, that's crazy. But that's not really the point of the story. The point of the story is, holy moly, what happened to this kid along the way? And they said, the kid's been through therapy. We've tried quote unquote everything. And I can't recall, was there electroconvulsive therapy? Was there this or was there that? But when you hear about what you're talking about, it makes me think, well, what if this was more mainstream and widely accessible, and this young person could have accessed this earlier? Maybe they wouldn't have been in this situation. So it's really interesting and cool to hear about it, because it offers at least the promise of and the potential for accessing a solution to problems we couldn't solve before, resistant cases, or maybe in a way that we couldn't get to before, i.e. if you could truly fast forward. And I hate to do that in life at any point, but listening about medical weight loss, the GLPs, they're providing a solution to things that couldn't be solved before, because now that we understand the physiology and the medicine, and we're realizing the pernicious and insidious way that obesity affects the human body and the ramifications of trying to solve obesity through traditional methods, which are still the best way, right? Eating less calories, exercise, work, but but yet here we are in this new environment of there's a McDonald's literally on every corner or something like that, and in the food sources and yada, yada, yada. It's really exciting to hear maybe this is a way to address where we are in our evolution of as a species, and the problems that we're facing that we couldn't do before with other older modalities that are, for whatever reason, they're long and arduous, can't find a practitioner, can't find a psychotherapist, yada, 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 yada. And so it's really super exciting to hear that, and I love that you're thinking about bringing this to the people you serve in the Tallahassee area and or wherever you bring this to in whatever capacity. Now, clearly, it's not all roses, right? Ketamine is a sympathomimetic, for instance. What kind of things do you have to watch out for? Who's not a candidate? Are there any precautionary things medically that you have to? Do you need to take any medications in addition to the ketamine during the trip? I think you mentioned that it was at least recommended, and you in fact did take something. I think clonidine, maybe an antihypertensive. Tell us about that. What do you have to watch out to?
Yeah, so there are some of that, and I want to
who can have it, who can't.
Touch base on a little bit of what you said before. I think GLPs for me have given some insight in the sense that I thought hard work was always the answer, and I thought that you just had to work harder, and I've had to realize that sometimes that is not accessible to everybody. It's very simplistic in a sort of
I gotta say, let me just explain to the audience.
Say, work harder.
Right, but you were the biggest proponent of that I knew personally, right? I mean, like
100%.
Like right, you were a big proponent of
100%.
Get over it, work harder, yeah. And there's something admirable in that, and there's something that is beneficial.
Nobody cares, work harder.
That, but it also, I've come to find out, I don't know, there's this gray zone where you just can't. It doesn't work for everybody.
Yeah, I think the GLPs offer me this avenue to realize that hard work as the sole answer is not always the right answer. I think I just assumed you should work harder, and I assumed I should work harder, therefore you should work harder. I've had to learn that sometimes that sediment, no matter how much that rings true for me, is not true for you, potentially the proverbial you. And it is naive and narrow-minded of me to think that that is always the sole answer. It may be part of the answer. It may be work hard because I've seen hard work for people who it wasn't necessarily accessible have a deleterious effect, and it actually leads to worse outcomes than as opposed to positive outcomes, because they're overcoming, working harder, and what they're actually doing is they're setting themselves up for a massive break. And so using that analogy of weight loss, I've also strongly believe you just work harder on your psychological. I had to go through long, arduous therapy and this and that, and why isn't everybody doing this? And that's just not always accessible to people, and not even just from a financial standpoint or a logistics standpoint, but it may not be the best answer. And it may be the answer is hard work, and maybe you hit a plateau, and maybe something offers you a breakthrough on that plateau. Maybe this is work use in conjunction. I don't think it absolves you of the work, because I think from my very limited experiential understanding of ketamine, the benefit will come from the ketamine and not just the ketamine, and not without the ketamine. Like I said, I don't know that I can say I wouldn't have gotten to the same understanding of those issues that I have now understanding of without ketamine, but I think it would have taken so long that I only have so much time, right? If it had taken me 5 to 10 years of mental processing, I mean, if every issue that is of major importance to me takes 5 to 10 years, and hopefully there's less and less, but shit, if I could do that in one trip and do that trip once a year, and I get 5 years from every one, that's huge, and that's a major bonus to me. And it maybe somebody who, and this is probably not my calling, but maybe someone who is suicidal needs extensive therapy, and maybe it's not the only thing they need. And I think sometimes going the other way, saying only therapy, or maybe saying only ketamine. I don't know that ketamine clinics where you sit in a doctor's office that's sterile and you do an IV and they send you on your way and you do 6 of them and you pay me $500 a session is actually that good either, because that seems like it would have been detrimental to my mental processing. Like I heard stories about you can't drive yourself home, talking about some of those risks, and so you have to have a driver, but some people don't have drivers, so they had to get an Uber. I'm like, if you would throw me in an Uber after this session where I'm in this neuroplastic state of mental processing, and then I'm now talking to an Uber driver who has no idea what's going on in my life, it would have been terrible experiential, maybe even detrimental. I have a former patient who was driving a couple hours away and didn't have the friend network to do all 6 of these trips because her family wasn't here, and they had to do Uber drivers and friends. And I was thinking back on that, like, God, that probably had a negative outcome on the potential benefits of this ketamine. So I think the ketamine-assisted psychotherapy is really, as it, again, very new to this, but seems to be much more significant than ketamine or even just psychotherapy. I think they're both important, but I think the additive value of both of them could be significantly beneficial. But it's not free. Nothing in medicine is. So when I got up there, my blood pressure was a little high. It was a borderline, 138 over 88, 138 over 90. And, I'm at altitude coming from sea level. I'm anxious, and they were like, hey, ketamine can raise your blood pressure during this. I'm like, yeah, so does exercise, and I work out super intense, and I roll, and I do CrossFit, and I sit in saunas. And they're like, cool, but we want you to deal with your blood pressure right now. We don't want to hear your stories about what else you do. And so one of the things that they did is they gave me a clonidine, which was also quite interesting and I think additive and beneficial. But blood pressure is one of the big ones. There are some specific psychological meds, that can hinder the effect. There are some specific psychological conditions that aren't maybe beneficial for it. I didn't spend a lot of time personally because I don't plan on dealing with split personalities and severe bipolar patients and some of these people, even some people with severe former trauma. Yeah. Yep. And maybe those need to be, that's why I'm like, I'm not a psychiatrist. Those need to be under the care of a psychiatrist. And she needs to have an understanding of the patient to understand if it would be beneficial for them. But outside of that, from what I understand, ketamine is a fairly safe medication when done properly, and I like the fact that it had dosing. I like that fact that it had protocols. I like the fact that it had different routes that gave you different experiences that could minimize some of those potential side effects. The biggest one that for me would be blood pressure management for my patients, because that's so widespread outside of a psychiatric condition. But
Right,
honestly,
so
people like you will inform some of that better for me.
Right, so we call it a sympathomimetic, meaning it acts like a sympathetic nervous system agonist. Like it raises blood pressure and heart rate, just like a adrenaline would, for instance, just to put it very plainly, or epinephrine, norepinephrine, noradrenaline. So you got to be careful. You can have big blood pressure spikes, tachycardia, those kind of things. But it also does not depress your respiratory drive, and in fact it enhances it. You can also have some increase in salivation, which can be the settings that you and I are using it in or experiencing are way different. Obviously, I was in more of the trauma and critical care setting and acute care in the hospital, rather than outpatient setting for these types of things. But nonetheless, it's something you need to know about the drug, and you got to make sure that the practitioner you go to can handle those things, which it sounds like you guys knew about that and we're offsetting that with the use of presynaptic antihypertensives like clonidine, presynaptic antagonists. So so you just got to know what you're dealing with, obviously, and you wouldn't.
Yeah, and I did a full health
You need probably
history and
a psychiatrist
clearance
input.
prior to doing my trip.
There you go. That's exactly right. Yeah, exactly. But
Yeah, so I met with a nurse practitioner, a psychiatry
Right,
nurse practitioner. They cleared me medically. They went through my whole drug history. They went through my whole health history. They screened me physically at the time of treatment. We did a physical exam at the time, both times at the time of treatment. So it wasn't what makes me somewhat nervous, and I think some people in the field is like sort of the mail order ketamine that's out there now. I think it diminishes the potential effect and puts a higher risk for
there's
patients.
mail order?
And not that you shouldn't have Yeah, I'm not going to promote their clinics. I don't think it's a good way to do it. But yeah, you can meet with somebody online and have it mailed to your house.
That's kind of scary. Yeah.
Lozenges, yeah. And we did 2 trips. It was kind of cool. We did 1 lozenge, 1 injection, and they were both very different. It was a pretty cool experience. The difference that changed the trip. It didn't change the end result analytically or psychologically for me. But the trip was different on both of those, and that was cool to experience. Which is good because it allows different people with different tilts to maybe.
Did you feel detached from yourself for several days after the trip? I was reading a Washington Post writer had struggled with depression, tried a ketamine trip, and he felt detached from himself. Had an experience with ketamine, then wrote about it. He felt detached from himself, and you were describing that, and almost like it was a positive thing. He describes it as it was a negative thing. He was scared. He felt strange. I don't, So it's, it obviously can affect different people differently. And I saw that. I could see that in the even in the acute setting. Like it was somewhat hard to predict, honestly. Some people went bonkers on it, and some people it was fantastic. I mean, you can kind of get a gestalt for it in the acute setting, who you could predict who it is. But do you? How about this? When you were out there, did everybody have a positive experience like you, or were there some people that didn't? Or do you know?
Nobody had a negative experience. We did some processing together as a group. There's probably 30 of us. Nobody that I know of had a negative experience. Though the worst negative was like I didn't have much of an experience. Your question's interesting because maybe I did feel a little disassociated from myself, but I felt disassociated from things like anxiety. I felt disassociated from things like holding on too tightly and wanting to plan. So termed that way, but it didn't scare me. It didn't even register to me until you just said it. But I guess said that way, if I was typically, like concerned with like a schedule and making sure we're getting this place on time, and that went away, it was great. But it was not my norm, so that could be spun as like a dissociated from myself. But it didn't ever feel out of control. It didn't feel like something I couldn't consciously bring. I honestly didn't feel like I felt like I didn't have the need to do it, but I could if I wanted to, but I didn't feel the need to do it. I also felt disassociated, I guess, in that term from sort of like I just felt better connected to my family. We were on a family vacation right after that. They met me out in Colorado, so we spent a week in Colorado after my training, and I just felt like a much better connection to them. So I felt disassociated from any negative, but we don't have a bad relationship, but any potential negatives in there, just like normal day-to-day stuff felt much lighter and much easier to handle. So yeah, I guess in some sense disassociated, but like you said, a very, very, very positive experience for me.
This is
which I think could be some of the positives for someone who's depressed if you
can get away from those things. Yeah. This says
Go ahead. What were we going to read?
I'm reading from it's drug free. This is about this guy. Ketamine therapy for depression does not work for everyone. Stephen Petro, a contributing writer for the Washington Post, shared his experiences with ketamine after years of treatment with antidepressants and talk therapy. Quote, "In the days that followed, I still didn't feel like myself. Detached, untethered, scared, in a world of my own. Several friends noticed this difference in me, with one asking me directly if I was at risk for self-harm," end quote. So, it's not the same for everyone, I guess.
No, and I don't think that's why I don't think it should be taken lightly, and I don't think, you should just assume all these are positives. I think from what I learned is people who are teetering already as sort of unstable could push them further to more unstable, which is why using ketamine as just a drug maybe not the best. Someone like that maybe would need to have somebody, a trusted medical source or a trusted source, to then fall back onto to process those feelings, as opposed to just taking it as a drug.
Right. A support system.
In certain traumatic experiences may come back and say you had repressed, so to speak,
PTSD.
for lack of a better term, repressed trauma, and that came back up.
PTSD,
Mm-hmm.
Yeah.
But if you maybe knew that episode and you were actively dealing through that episode, that might be a positive. But if you had so suppressed it that it came up and you had nobody there to deal with, and it disassociated you to the point where that repression went away and the memory came back, and now you had no one to process that with, that would be a very negative experience, I feel like. So being able to screen those people out, I think the instability, the people teetering on the edge, the people already sort of like a bipolar-esque, tends to be very emotional, very, maybe not the best for them. I tend to be, and I notice with other people in there, the people in there that tend to be, like openness would be maybe a term to describe where I could move into as a positive. Like I tend to be tight and closed and less emotional, and maybe would benefit from more emotion. And so if you maybe had the opposite, where you tend to be excessively emotional and you tend to be unstable, and I tend to be too grounded, that felt good for me. So maybe potentially excessive just could manifest that. But I think the key there is having somebody to give you that insight into they've had the experience, they understand that from you, from a medical history, from a psychological history, and they understand the medication from that perspective, could then give you insight to whether this would be a good or a bad thing.
That's a really interesting, that's very interesting that you said that. In his quote, he said, that was great. Let me tell you why. In his quote, he goes, detached, untethered. He used the word untethered. Well, you're right. If you are a person who's kind of reeling and you feel out of control already, untethered, and your emotions are running away with you, and you get more untethered, that could feel scary. But if you're somebody who's too grounded to the point where you long for more levity, or you need to be more untethered, so to speak, or that you could benefit, you're too tethered, it actually probably feels liberating, right? I mean, would you say that's true from your perspective?
Yeah, that would be a good word for me. Very liberating. Yeah, it felt liberating. Yeah. It felt positive. It felt to give me a sense of liberation. And that quote to what he said that would feel good to me, like to be a little. Not have so much control, to not have to worry about maybe controlling me and controlling you, right? And controlling that person and controlling, I tend to be a micromanager, and I tend to want to control everything, and I tend to find benefit in that because then it's comforting. And so all those things that were spun from him as a negative sounded kind of cool to me, and they were actually a positive for me. And so I think, yeah, that is, and so you need
That's
to have that
interesting.
insight.
Maybe
You
a
need to be able to talk
clinical-
to somebody about that.
And assess that clinically. You're right. Is this person which of the? I mean, we're not psychiatrists, either one of us psychologists, but that's just an observational little morsel there. So are you going to have another trip? Are you going to seek it out? What do you think?
100%.
Are you there?
Yep. I tell people the breath work led me to the ketamine.
Nice.
The ketamine's leading me somewhere else, and it will definitely be another trip. I think as somebody who's never experienced any psychedelics,
so is
any
it a gateway drug? Are you
dissociatives,
going to try
any
something next? Are you going to try
drugs as a
mushrooms?
teenager. Is it a gateway drug? I think it is a gateway drug in the sense that I don't feel a longing to do more, and I don't feel a longing to keep doing it, but I feel a comfortability with the proper accessing of the altered states of consciousness that I would like to further access altered states of consciousness. But I don't feel addicted, a need or desire to have it, but I feel like, man, that was a positive. Someone asked me, and I said, maybe once a year, maybe twice a year. I think there's some processing that has to happen. I think there's some benefit that has to happen, and I still feel like there's some unprocessed things. Similar to going to talk therapy, I sometimes go weekly for a month, and then sometimes I'm like, I'm not going to go for 6 months, or 2 months or whatever. So in that same sense, I feel like there may be some things that I would like to access. I think personally, and just being honest, breath work led me to an altered state of consciousness that made me know that was going to be okay. Ketamine allowed me to access it further, that let me know that it'd be a positive in my life, and I would like to try something else. I feel like psilocybin and MDMA would be positives for me. However, something like ayahuasca does not seem like it would be a positive, something that I would like to try at this moment in time. From what I know of that, I don't think it holds much benefit for me. So I think it's given me an honest, objective way to assess this world that I feel positive about.
All right, man. Well, this sounds excellent. I'm glad you had a good trip. I was a little worried that it might be kind of funky, but it sounds like it was a completely positive experience. I'm looking forward to hearing more, living vicariously through you. I'm open to doing it sometime, but I don't think I'll be doing it anytime soon. I'm gonna let you wade in that pool a little bit and make sure you don't get taken under by a shark or something, metaphorically, and then if everything looks safe, I'll dip my toe in it there. And so you have to keep us posted about your next trip or your next
I'll be here to
psychedelic of choice. And keep us updated what's going on in the clinic.
Yeah, I'll be here to guide you. I was wondering if you would want to do that. Yeah, and I'll let you know how it goes with patients. And we're going to do a small team, and I'm going to take this cautiously, and I'm going to take this.
I'll do it. And I'm
patient by patient, so to speak.
I love too that you got the perfect look for a shaman, the beard and everything. Get you some like.
I never knew I was already on the shaman track before when I just growing this out. Put some beads in my beard and
you're a Viking shaman. A Viking. Yeah, I think a Nordic shaman.
I like it. It sounds great. I think Nordic shaman.
Have you ever watched that show Vikings?
Tagline. That'll be my Instagram tag.
Yeah, have you ever watched that?
Oh yeah, of course.
Oh, there's a lot of that psychedelic. They have these trips. I don't know that. I don't recall it being like them actually taking a drug, but they definitely have these like dream states that they're constantly accessing and doing weird stuff, like in getting insights and visions. And
I think it is a significant part of ancient cultures and ancient rituals, and I think it is an old medicines, so to speak, that have been around for a long period of time across different cultures, and I think we're just now coming back to it, and it holds some potential promise in today's society.
100%. And just as a throwback to the old dude, I gotta tell you something just to close out, and maybe I don't even know if we record this or not, but there was there was a 68-year-old Brazilian guy came in. He is the dad of one of my patients. And he was visiting from Brazil, born and raised in Brazil, lived there, still lives there, comes to the States once or twice a year, visit his son over here, and his son wanted his labs and was curious. The guy he's 68, he wakeboards, he works out every day, little shrimpy, skinny guy, but he had a six-pack abs. 60, not intentionally, just as a byproduct, he lives on a farm, farms every day, blah, blah, blah. And so we took his labs, and my buddy my patient rather, was interested in his dad's testosterone level, among other things. You know what his testosterone level was? Just guess. 68 years old.
800.
952. Isn't that crazy?
I'm jealous.
I was like,
peanut butter and jelly over here.
60 peanut butter and jelly. 68 years old, dude. And I was like, I mean, it was like, you're the living proof of that. You're like the ancient man. Very sinewy, like strong, but like not. I mean, very skinny, strong. I mean, small, little, very demure in his, not like some aggressive, like, asshole of a guy. Like, 952. I was like, holy moly! I mean, it was like unreal.
Beautiful.
Great white buffalo.
Maybe I can get there. Maybe I can reverse it all. The great white buffalo.
Yeah.
The great Brazilian buffalo.
The great Brazilian buffalo. Those damn Brazilians, man, they got the best genetics. All right, brother. It was good talking to you, and we'll see you next week.
All right, buddy. Good talking to you, man.